because they think it's rare, it's not taught, and therefore they don't learn about it, and so they don't see it, they don't recognize it. It's a self-fulfilling prophecy that it remains underdiagnosed and under-recognized and ignored.
Hello, everyone. I'm Kelly Barta. I am the president and the executive director of ITSAN, the International Topical Steroid Awareness Network. And I'm here today with Dr. George Moncrieff to talk a little bit about TSW. I wanted to ask you just to give some background of your medical history, of your practice and your teaching and things like that. I think it would be helpful for people to know that.
Yes, I'm a family doctor. In Britain, we call people like me general practitioners. So I worked in the community. I've always had an interest in dermatology. It started at medical school, or possibly before, because I had psoriasis as a child and needed light therapy and things. So I had quite bad psoriasis. And when I was a junior doctor working in hospitals, it certainly was with the stress of that and the awful hours. My psoriasis was pretty severe. But I had an interest in dermatology and rapidly discovered that my colleagues didn't. That the average doctors had less than a week training at medical school in dermatology, and many people at family doctors had no training after they qualified in dermatology. So I had the confidence to then say to my colleagues formally, do you want me to see your patients with skin diseases? And so we set up a community service about 25 years ago. And in the end, about 50 doctors sent almost all their patients with skin problems my way. And I gradually built up my confidence in managing skin diseases. Meanwhile, I became the curriculum guardian, just to determining what it was a GP ought to know, a family doctor ought to know about dermatology for the Royal College of GPs. So I did that for 4 years. And then I moved on to becoming the chair of the Dermatology Council for England, a wonderful organization which brings together dermatologists, family doctors, nurses who have a specialist interest, the pharmaceutical world, both big pharma and small pharma, and most importantly, about 100 patient support groups who were absolutely fabulous and hugely supportive. And so really trying to represent all their views on behalf of the patient. Throughout all this time, I was a trainer in general practice. I taught GPs coming along. They'd have a year with me. I was also a tutor for undergraduate medicine in Oxford and at the University College in London. So I'd have students coming out to stay with me sometimes. I didn't want to end up being in just one field of medicine. I wanted to look after children. I wanted to look after old people. I wanted to look after terminally ill people, pregnancy.
Wow.
That's what general practice gave me. And you look after a community for 35 years. So you will have looked after their granny who died. You will see their babies getting born, and you see those babies growing up and going to university and getting married.
It's amazing.
The family doctors in the old-fashioned sense.
Yes. Oh, I love it. Well, we are so grateful to have you championing this issue with our community. You are the epitome of what we all hope a doctor would be that we would see. So we're just very thankful for your involvement and
That's very kind of you.
here.
I didn't know I deserve it, but thank you.
Yeah. So I had met George several years ago, and it was after he had done a TV interview talking publicly about TSW. And at this time, there were not many doctors who were willing to do that. And I had reached out to him because we were working on TSW awareness resolutions to use here in the United States to help parents and other people who are dealing with TSW and to call for more research. I had asked him if he would be willing to write an endorsement to help back up this resolution. And I wanted to read that to you just to set the stage for our conversation today, because when I opened up his email, I actually got tears in my eyes because here was a doctor who was so empathetic with our community, and not many were willing to acknowledge what was happening on a large scale and really take ownership of that. I can't tell you, Dr. Moncrieff, how much that healed a piece of me, even 10 years later. And so I wanted to read that for our community before we get started today. And this is what he said. Topical steroid withdrawal syndrome is miserable and is often utterly devastating. One of the major issues facing people suffering with this is the lack of support and advice they get from the medical professions, who repeatedly assert it is rare and consequently miss it or dismiss it. As a result, it remains underrecognized, leading to the misperception that it is rare. Sadly, it is not rare. The true prevalence is unknown. And furthermore, for unknown reasons, it appears to be becoming more common. Patients with this condition have been dreadfully let down by the medical professions and left to manage their catastrophic skin failure on their own, often resorting to social media and unqualified advice. Doctors feel uncomfortable when they don't understand a condition and do not have the answers. It is loads easier for us to label patients suffering with this condition as steroid phobic and blame them for undertreating their uncontrolled eczema. TSW is not simply under-controlled severe eczema. It looks different, feels different, and involves areas of skin previously not affected by eczema. People suffering with TSW need the caring professions to care. We all urgently need to understand this condition. That needs high quality studies, which might hopefully in the foreseeable future provide us with some answers and advice on how to help this awful skin condition. TSW is a gift for someone looking for a fascinating and rewarding area to research for a PhD. So thank you again, Dr. Moncrieff, for that endorsement and just for your real care for this patient community and for your support for us. And I'll go on to say that this past year, Dr. Moncrieff became a member of our medical advisory board and helped us put together a guide for doctors. So he essentially wrote a letter to doctors saying, you know, your patient believes that they have TSW. Here are some ways to differentiate it from eczema. This is a tool that is so helpful for our community who, you know, go to their doctor. Their doctors have not heard of this. Sometimes that can make a patient feel then dismissed if they're not taken seriously. So this is a resource and a tool that could be super, super helpful to rebuild that relationship with your doctor and work on that together. So Dr. Moncrieff, I wanted to start the conversation just asking you, when was it that you heard about TSW and actually recognized this is something different than eczema?
Goodness me, I can't really remember. It would be somewhere around about 10 or 15 years ago, which is shocking because I think it was certainly an issue and a problem for many patients for at least a decade or more before that. And certainly, I think it was first described in 1970.
Mm-hmm.
And I wasn't aware of it. Yet I was working, although I'm a family doctor, and that's my main field, though I'm retired from that now. I've certainly spent 25, 30 years really significantly in the world of dermatology. And I wasn't aware of it until only 15 years ago, perhaps.
And how did you see it as being different than baseline eczema? So when patients were talking about this, how did you start to see the difference? And one of the questions that we often ask is, what changed your mind about this condition, that it's not eczema,
Yeah,
something
yes,
else?
very interesting. Those thoughts have crystallized as time has gone by, and I've got a much clearer view on it now than I would have had then. But I suppose originally it was noticing that it tended to occur in areas the patient had never had eczema before.
Mm,
It was redder, much more angry.
mm,
Um, and the people are complaining, although it can be intolerably itchy and significantly more itchy than eczema even, sometimes it's burning and stinging, which are not particularly symptoms that I would often see with eczema.
mhm,
So it was different. More recently, I recognize the dramatic flaking and peeling that can occur with this condition way more than you'd ever see in terrible eczema.
mm,
And so these are different, very definitely features that distinguish it from ordinary eczema. Another fascinating thing, which I think definitely merits research, is how it rarely involves the palms or the soles,
mhm,
and perhaps nor does ordinary eczema. It can do, but it doesn't, not so often, because the skin is thicker and more resilient there naturally. And but it often stops very abruptly.
mhm,
Now, when I'm teaching students and family doctors about recognizing a skin rash, one of the things I say is look at the edge. How does it merge into the surrounding unaffected tissue, unaffected skin? And some conditions like psoriasis end very abruptly. Stable psoriasis, you go from abnormal skin to normal skin, and you could draw a pencil around the edge.
mm,
Whereas eczema typically merges into the surrounding tissue, into the surrounding skin. And yet, topical steroid withdrawal often has very sharp boundaries, often at the wrists. It's a well recognized sign.
mhm,
A history of eczema and They've been managing it fine for many years or decades. They know what they're doing. They use their steroids responsibly.
Mhm.
And then suddenly something changes. And they know that they're putting the steroids on and it's getting worse. And
Mhm.
it's behaving in this abnormal way, beginning to affect other areas like the genitals or the face, which hadn't previously been a problem.
Mhm.
Thin skin areas where the skin barrier is most vulnerable. And they get this extreme redness
Mhm.
and pain, and it can go on to the skin peeling off. And as you all have probably experienced,
Mhm.
um, catastrophic flaking and absolutely disastrous.
Thank you for that. So another question I wanted to ask you, there is a lot being talked about on social media with TSW. And one of the complaints that the medical community has is these are people who are misdiagnosing their skin because it's XYZ. I think it's important for people to understand there may be conditions that have similar symptoms, but they could be a different diagnosis. Could you share with us some of those conditions that could exhibit similar symptoms to TSW?
I think what you're probably alluding to there is something that patients with eczema are particularly vulnerable to. And if their skin barrier has been catastrophically damaged in this way, even more vulnerable, known as eczema herpeticum.
Mhm.
Um, Now, this is a frightening disease, and it's one that doctors won't see very often, so they won't be particularly good at recognizing it.
Mhm.
And it's where the herpes simplex virus, which normally is not much of a problem. It can cause cold sores. It can be more severe. Primary infection with that virus can be particularly unpleasant. I'm not talking about genital and sexually transmitted herpes. It's not usually that virus. It's the same family, but it's a different type of herpes. Um, and the ability to keep that virus at bay is compromised.
Mhm.
Very suddenly, the skin develops herpes-looking lesions, which are initially what are called vesicles, clear fluid bubbles on
Mhm.
the skin, only about 4 or 5 millimeters. But those rapidly break down into little craters. And they typically of the same age, they all develop at the same time, the same size. So we call them monomorphic, one shape. Most common on the face, but they can be over the body,
Mhm.
mostly in areas that are previously affected with either eczema or damaged skin in this way. And this is a potentially lethal condition. It can go on rapidly, and I mean in hours, to the
Mhm.
patient being seriously ill on intensive care. And it can cause a herpes encephalitis, and it can cause eye problems. It's very dangerous, and it really does need urgent, rapid, initially intravenous antiviral therapy. So if you suspect it,
Mhm.
you've got to take action, and it's quite different, and you're ill. One of the things I teach the students that I used to teach and the young doctors is every time have a patient encounter, every time, make a decision. Is your patient unwell?
Mhm.
In which case you've got time to work out things, or are they ill? And there's a big difference between being ill and unwell. And if you've got eczema herpeticum, you're likely to be ill, and you've got to get to the diagnosis fast. So this is a condition you must be aware of. Often on the face, can be more widespread. Starts off as little, initially clear fluid bubbles, which doctors call vesicles. They can become more creamy colored. They rapidly break down into craters,
Mhm.
usually about 4 or 5 millimeters or so, covering sheets of areas of skin, and
Mhm.
it's all very rapid,
Mhm.
and it needs urgent intravenous, often antiviral therapy.
Thank you. So we do see this commonly in our community, and it's one of the reasons why I did want to talk to you about herpeticum because patients need to be aware of it and then know when to recognize, okay, I've been exposed and this is starting to happen.
And to know that their doctors won't necessarily be that familiar with it. They
Right.
won't, if they're not working in dermatology, certainly if they're family doctors or working in an emergency department, it's
Hmm.
not something that's going to come through their door very often, and they may never have seen it before. So it's not
Hmm.
going to be at the front of their mind. So
Hmm.
the patient needs to drive that diagnosis to some extent, and their family or friends who come with them to
Hmm.
not tolerate people saying no, you're okay.
I know when I experienced herpeticum, and I'll share a little bit of my story because many people here may not know what I went through. I had developed a couple spots behind my leg, and I thought it was just, some odd symptom with TSW. I was used to my skin doing strange things. At this point, I was 4 years after stopping steroids, so I had been through the worst of TSW and still recovery. But then I started feeling really ill, to your point, where it almost felt like a flu was coming on. My lymph nodes were starting to enlarge. I just felt that something internally was very off. And my neck started to weep profusely. I was itching in a different way. Like the itching was different than TSW, where I can't even really describe it. It was terrible. I started getting other bumps on my arms. And so I went to my dermatologist and she took a biopsy and she told me, I want you to go straight to the ER, the emergency room. Don't even go home. You're very sick. And by the time I walked out of her office, I almost passed out. I mean, this is how fast it started, just within maybe 2 or 3 days of just feeling sick, my neck, then the spot starting on my arm. And I'll share pictures on this, but within another day or so, it spread full body. I nearly lost my life. But my hospital at the time, they thought it was bacterial. They started me on IV antibiotics and it wasn't touching it. I was spiking a fever that they could not get down. And I reached out to the current president of ITSAN at the time asking, is this herpeticum? Because I'd heard about this in our community. And I showed her pictures and she said, absolutely, ask them to put you on an antiviral like you had mentioned. And I found out later that it takes 24 hours for those to really kick in. So in the meantime, it's still spreading. So it's so important that these are started right away. And they put them intravenously. I was in the hospital for a while and then finally was sent home, but it took me more weeks to recover and I was on very high antivirals. And then afterward, I was having recurrent infections almost every month because I think my immune system was down. I'm not really sure what was going on, but I had to use antivirals for quite some time. And now I keep them on hand always in case it just pops up out of nowhere. When I travel, I make sure to always have them with me because it's true. You want to nip this in the bud because it can spread really quickly. And it's so painful. I remember feeling in the hospital.
Very painful,
I,
yes.
I
Like cold
couldn't,
sores are painful, yes.
so painful, worse than TSW for sure. And I think that was another indication for me. This is something different than I've experienced before. But I couldn't even put a sentence together. That's how sick I was. I was at the mercy of my hospital attendants and my family speaking up for me and really fighting for me in that setting. So
Terrifying.
really
Yeah.
important, yeah, for our community to understand.
Such an important message. There is a related condition, which is not quite as serious, called eczema coxsackium.
Hmm.
The Coxsackie group of viruses, there are Coxsackie A viruses and Coxsackie B viruses, and they're a very interesting group of viruses that cause a lot of skin problems. But most people have heard of hand, foot, and mouth,
Hmm.
um, which is usually caused by Coxsackie A16, but there's a very nasty variant called A6,
Hmm.
first described in Taiwan, I think in about 2011, which produces a subtly different illness. But if somebody has skin that is vulnerable, and eczema skin is very vulnerable and immune damaged, and the sort of skin that patients with TSW are likely to be suffering with, will
Hmm.
be particularly vulnerable to this. And if they encounter this, their child comes back with hand, foot, and mouth, which most adults are, not all adults, but most adults are immune to.
Hmm.
Um, it can suddenly go quite out of control. And it doesn't have the same really serious risks
Hmm.
that eczema herpeticum has, and nor does it respond very well to antivirals. So it's
Hmm.
just a miserable, painful condition. But it can look a bit like eczema herpeticum.
And what is the treatment for that?
Really, you treat the skin. I don't think there's any specific treatment for it,
Hmm.
and it gets better on its own. Usually, you
Hmm.
support the patient.
Hmm. Okay. I wanted to ask about staph infections as well,
I was
because
going to come on to that.
all right,
Yes. Yep.
yeah,
You're
sure.
talking about the doctors thought that yours was a bacterial infection.
Yes.
And yeah, the best protection our body has against bacterial infection or any pathogen getting into our bodies or onto our bodies is an intact skin barrier.
Hmm.
And a skin barrier is the primary problem in eczema.
Mm-hmm.
That's the problem with eczema, is damage to the skin barrier. And in TSW, the damage is on a different scale. And
Mm-hmm.
so when you've got damaged skin barrier, your skin is particularly vulnerable. And it normally there's a really nasty bacteria called Staphylococcus aureus. Now, some individuals don't carry very small amounts of that, and they just happen not to be carriers of it. About perhaps about 1 in 3 of the general population carry Staph aureus. It's called aureus because it means golden. When you grow little colonies of it on blood agar, it looks golden colored. And to distinguish it from Staph albus, which produces white colonies, and Staph albus is a much healthier staphylococcus to have on your skin. It's part of a natural, normal microbiome, but and actually competes with Staph aureus.
Mm-hmm.
Um, if you have Staph aureus growing if you've got a wound in the skin, you will have Staph aureus there. There's not much point doing a swab. It will grow. It doesn't need to dictate what treatment you give. There will be bacteria there. All flares of eczema are infected. They will have staph in them, and they will have loss of bacterial diversity,
Mm-hmm.
particularly affecting the deeper layers of the skin, which is possibly more important than the surface of the skin. So there's papers coming out looking at that in some detail and the microbiome at different layers.
Mm-hmm.
But if you've got overgrowth of staph, that can cause dramatic crusting.
Mm-hmm.
Staphylococcus is one of the bacteria that's usually involved in impetigo.
Mm-hmm.
The word impetigo comes from the Latin meaning, or the word impetere, meaning I attack.
Hmm.
So impetigo just whoosh goes really attacks. So you get these crusts. The patient isn't usually very ill, but the skin is catastrophically infected.
Hmm.
Um, but staph can cause many, many other problems. It can get into the body and can cause osteomyelitis, an infection of the bone, or into the lungs, causing abscesses or the brain. It's
Hmm.
a dangerous bacteria.
Mm-hmm.
And if your skin is really badly wounded in the way of TSW, you are particularly vulnerable to that. And
Hmm.
you, eh, not all staph needs treating, interestingly, not with antibiotics. Normally in eczema, I teach it will be infected, treat the eczema, and the body will clear the staph.
Mm-hmm.
Studies have shown that giving antibiotics to mild flares of eczema don't make any difference at all. They just mess up the microbiome.
Hmm.
So leave the microbiome alone. But if you've got really badly TSW affected skin and it suddenly gets out of control and it's not forming these little bubbles, which break down into craters, and you're not ill, then it may be that you do need an antibiotic, or I would say better still, an antiseptic.
Interesting. So this is a challenging question, I think, that a lot of patients have too. And I remember when I first started TSW, you begin to ooze. And a lot of times, to your point, oozing is associated with infection. And there's a smell that comes with TSW too
Yeah.
that many people are aware of. And I remember when that started, I thought, oh no, I'm infected. And I had my husband go out and buy like bacitracin or like a spray antiseptic. And I was spraying it all over my skin, which you can imagine was extremely painful because my skin was so open already and I was spraying this stuff. It was awful. Well, it finally, I realized this was not infection that I was dealing with. It was a TSW symptom. But how do patients understand, like to your point, when it crosses over into something that needs
Mhm.
treatment by a professional? Like it's now an infection that needs.
Yes. Well, certainly fever would be a point.
Mm-hmm.
Um, getting worse. I suppose the degree of oozing, the degree of crusting, feeling ill,
Mm-hmm.
feeling achy, having fever, as I mentioned. Those would be the sort of signs that I would go for to say this patient perhaps needs more aggressive treatment. Something I would want the community to be aware of is something called hypochlorous. Have you heard of hypochlorous?
No.
Hypochlorous was discovered 200 years ago, but dismissed by the medical profession because it was very unstable. Only stayed in a water solution for about a few hours, maybe a day.
Mm.
Well, over the last 20 years, they've managed to stabilize it in an aqueous preparation called, the one that I like is, there are various preparations, but the most stable and the most pure is called Clinisept.
Mm-hmm.
Um, and they produce one that you can buy over the counter called, or on Amazon, called CliniSoothe.
Mm-hmm.
And this is stabilized hypochlorous. Hypochlorous is 80 times stronger than bleach or
Well,
Milton. And that's hypochlorite.
mm-hmm.
I wouldn't put bleach or Milton anywhere near the skin. It's a disaster for the skin. It's
Mhm.
highly caustic. It's very a strong alkali, and I think is the worst thing you could ever do, even in diluted forms.
Mhm.
But hypochlorous is produced naturally
Mhm.
by our own bodies
Mhm.
as part of what's called our innate immune system. Our white blood cells make hypochlorous as a part of our natural defense against infection.
Mhm.
And as I said, it's 80 times faster than bleach at killing bacteria. In fact, this kills all bacteria, all viruses, including COVID, prions, which cause things like BSE and Creutzfeldt-Jakob disease, fungi,
Mhm.
and fungal spores. I know of nothing else that kills fungal spores, and it also kills yeasts. So it kills all the pathogens, and
Mhm.
it's totally non-toxic to human cells.
Wow. So why don't we know more about this?
I don't understand. I think it is amazing stuff. It's also anti-inflammatory, so it doesn't sting.
Interesting.
I've used it for sunburn, and a patient with blistering sunburn put it on his back with pads, left it
Mhm.
there for 20 minutes. 24 hours later, his skin almost looked normal.
Wow.
Um, I've used it for somebody had some nasty insect bites and spent the night scratching them.
Mhm.
Um, and came over to our house in the morning, and she said, what can I do? She hadn't slept all night. She said, what can I do with these? I said, well, let's try some Clinisept. So we sprayed Clinisept on them. Within 2 minutes,
Hmm.
they stopped stinging. They never came back.
Wow.
But my grandchildren get stung with stinging nettles.
Hmm.
Within 2 minutes, they stop stinging. Um,
Oh.
so it's a remarkable product, and I would say if your skin is broken and the other amazing thing about it is it doesn't disturb the microbiome. I've just told you it kills everything, and you'd have thought it'd be like napalming the skin. Um, but it depends on the pathogen triggering an immune response in the body to that pathogen, something called the respiratory burst.
Hmm.
And the bacteria or the virus is not triggering our own bodies to. So, in other words, what it's doing is complementing our own immune system. If it's not triggering our cells to recognize it's acting as a pathogen, we
Hmm.
leave it alone. And so, the microbiome, which is so important, and I think more and more about the skin and gut microbiomes every day.
Hmm.
Um, but if the microbiome returns completely back to normal within 2 days, and it's
Wow.
barely disturbed by it, so it's attacking the aggressive bacteria
Okay.
that you matter. If you've got healthy bacteria that are there doing their normal job, it leaves those alone, which is utterly amazing.
Amazing.
So you can buy it over the counter, and I would say if you've got a cut, it treats acne, it treats rosacea. It is quite extraordinary stuff. And so I would say just spray that on the areas that you're concerned about. And
Mm.
I think and it wouldn't sting. It should be quite reasonable to put onto TSW afflicted skin because there's not much you can put on that
Right.
and should soothe it. It can have it can be contaminated with a tiny amount of hypochlorite, so it can have a slight bleachy smell occasionally, but
Hmm.
no one's ever reported any problems with it damaging their towels or flannels from bleaching effect. So
Okay.
it's an amazing
Wow.
product.
I'm excited to look into that myself. So I found something that was recommended by another person in our community whose naturopathic doctor had suggested it was a colloidal silver gel with glutathione. And I had a really stubborn red rash on my arm that I had for months, and that cleared it right up.
Yeah.
Which I had tried all sorts of things. So that too was extremely helpful. So I kind of want to turn the corner a little bit on our conversation and ask you in particular about when patients are thinking that they're dealing with TSW, what should their best approach be when they go to speak with their doctors? And like I had mentioned, you wrote a really nice letter to put on top of our doctor's guide that people can bring along with them. But patients already they're scared. They're feeling a lot of physical discomfort. They're feeling maybe a little bit intimidated going into a doctor's office. I remember back in the day before all of this happened to me, I was just nervous. I mean, you go in, you're sitting in a paper robe. on top of a, really uncomfortable cold room, and there's a person you don't really know examining you, and my blood pressure would go up, and I'd feel nervous, and my mind would go blank, and I'd forget all the things that I wanted to say. How can we empower patients when they go to see their doctor about something like this, that already that you might have some intimidation, but now you need to talk about a difficult subject? And, if you're on social media, you're seeing everybody and their terrible stories of what they've experienced. And so you're already nervous. How can patients go in and have a productive, respectful conversation with their doctors to really, establish the environment for a good doctor-patient relationship so that they can work on this issue together?
I think first choose your doctor. I think that's probably if I always think that the first opinion has to be the best opinion. People think that the second opinion is going to be better, but it's second best to me. So choose your doctor carefully. I think bear in mind that the vast majority of doctors, and I mean the vast majority of doctors, will not be very comfortable or familiar with this condition.
Mm-hmm.
They may have heard it, but then they would have heard the profession advising them that this is quite rare and that the vast majority of patients don't have this at all. They have undertreated eczema.
Mm-hmm.
So you're going to be almost inevitably encountering somebody who is unfamiliar with it and has rather negative views about it.
Mm.
I think that has to be taken as sadly, as a terribly sad indictment and reflection on my profession, which I am ashamed of.
Mm.
And because they think it's rare, it's not taught, and therefore they don't learn about it, and so they don't see it, they don't recognize it. It's a self-fulfilling prophecy that it remains underdiagnosed and under-recognized and
Mm-hmm.
ignored. Doctor won't respect you unless you respect them.
Mm-hmm.
So you've got to have a relationship which is based on respect and listening. And I think it's worth listening to what the doctor's got to say and then challenging the things that are wrong. You're living with your skin 24/7. You know it.
Mm-hmm.
The doctor doesn't know about the condition, you probably doesn't know about the condition you're talking about and won't have seen much of it. And when they have seen it, will have dismissed it and then the patient won't go back to them. And so they'll have been able to ignore that it exists because the patients they assume get better because they don't come back, but they don't come back because they weren't happy.
Mm-hmm.
I think you need to say, look, I would bite your hand off if I thought that a prescription of steroids was the answer. And that was what I thought at first. And that is what I naturally and obviously tried.
Mm-hmm.
But my skin is behaving differently. And these are why.
Mm-hmm.
This is where it's behaving differently. This is why it doesn't fit in with that model that this is undertreated eczema or whatever.
Mm-hmm.
I have used steroids for so many years. I knew what I was doing with them, but now my skin is behaving differently. This is different, and I need your help. Now, that's the next problem. We don't really know how to help patients with it. And that's a horrible position for a doctor to be in.
Mm-hmm.
One, for the patient to know more about a condition than you do, to be on unfamiliar territory, not to be in control. As a doctor, you spend almost all your working life in control. You're dealing with things that you know about. You've been in this situation before, and I think that intimidating you by putting you into a cold room with a white tunic on or something. It's all part of this dynamic of the doctor being in control. They're standing up and you're lying down, and they're looking down on you. That's not my way of operating.
Good.
So I don't remember it ever happening. So it's much more of I want the patient to tell me what they think. I want them to tell me what their ideas are, what are their concerns,
Mm-hmm.
and then ultimately what are their expectations, and then I can address those and say I can meet these, but I can't meet those. But let's work on these together. Where can we find some common ground where I can actually offer you some support here?
Mm-hmm.
But I think don't go into it challenging. Just say, look, I would bite your hand off if that was the answer. It's so obvious. It'd be wonderful. I wouldn't be here because I would have done that.
Mm-hmm.
It's not happening this way.
Mm-hmm.
please, can we just accept that my skin isn't responding to this particular drug?
Hmm.
I am not afraid of steroids. I've used them for years, and I would love to be able to use them now, but I know that they're not the answer because I've tried that and it's just making it worse.
Hmm.
The doctor will be maintaining, no, you're just not using enough. You're not using them generously enough. You're
Right.
afraid of putting them onto broken skin. Eczema is broken skin. We do put steroids on broken skin. You're you're using too weak a one. We must go up the strength. No, I've done that. And
Mm.
of course I would do it. That's the most obvious thing to do. But I think if the doctor's not listening and not prepared to say, okay, prepared to accept that they might be wrong and you might be right, then I think you're with the wrong doctor.
Hmm.
I think don't waste any time with them. Um, Unfortunately, how do you find that doctor who
I
is
know.
prepared to say, I don't know,
Hmm.
and I don't even know really quite how to help you, but let's look at what we can do
Yeah.
and let's see where we can find. And I think just to show some compassion and some empathy,
Hmm.
at least you're in there with them
Right.
and you can suffer, although you're not suffering it firsthand, you can suffer as much as you can. And to think about, you describe this awful situation that your marriage is affected by it, your everything is affected by it.
Hmm.
Um, your ability to work, your ability to get out of the house,
Hmm.
put clothes on,
Hmm.
uh, is asleep. So there are many different areas where the doctor could potentially offer some support and help in more practical ways, and yet alone effects on your mood and your self-esteem. And a beautiful young woman suddenly becomes swollen and peeling and red and miserable,
Hmm.
and it destroying the personality.
Hmm.
So I don't have an answer for that one because it's something I'm ashamed of within my profession that I'm hearing this so much.
Hmm.
And I even lovely doctors who I have enormous regard for. I was at a meeting where two doctors who I hold in great, really high esteem, two dermatologists,
Hmm.
and they teach on a regular basis. And the topic of TSW was raised, and they gave each other a look as to say, here we go. I bet they've been on social media and just sort of putting the patient down. I just thought, I hold you two in such high regard,
Hmm.
and yet this is a disease that you're prepared to be so condescending and so rude about.
Hmm.
It was a real shock to me. Subsequently, they have actually begun to recognize that actually there is something going on here. And I see the early roots of our profession
Hmm.
begin to acknowledge,
Hmm.
hang on, we've got to think about this. And as I say in that piece you read out at the beginning, a wonderful area for research. If I was happened to be a professor of dermatology, I'm a long way from that. But if I were, I would be saying to my colleagues, look, this is such an important area. There's so many people who are badly affected by it. We need some answers. And I'm just seeing the first roots of that coming to light
Absolutely.
gradually.
Yeah. I'm seeing it too. And there's been a lot of resistance from the patient community. We felt a lot of resistance. But by continuing to show up and tell the story, I'm seeing that the message is getting through and getting through to the right people. It takes time, and it takes humility, I think, on both sides. It's
Yeah.
really difficult. I remember it took
When
me,
you're ill, when you're hard ill and you
oh,
look all
yeah.
and you know
Yes.
you were beautiful before this happened, and now all they see is this crusty, swollen, deranged, miserable, tired, exhausted, ill person.
Yes, it takes a lot of strength to show up in the first place to tell the story,
Yeah,
especially when you're told, you're just under treating or you're an anti-medicine or not adherent. We hear that a lot. In fact, I recently listened to a podcast with a dermatologist who said, the one organization who's talking about this, ITSAN, is telling people to stop all medication. Can you believe that? And this other dermatologist, oh, that's terrible. I thought to myself, we've never ever said that.
no,
Where are you getting that from? I mean, we've talked about stopping steroids because that's been the offender, and we do
yeah,
need to stop that medication, but never have we said don't use medications. And so we have been seen as, and I heard someone coin this phrase as the TikTok tabloid community. So when you're
mm,
suffering and you're being looked at like by the experts and the medical professional, like you're you're a crazy person and you're telling people to suffer. It's its own form of trauma.
It is. It
And
really is. Yes.
it's so difficult. And I think that's why like the big explosion on social media has happened because patients aren't getting support where they need it. And so the only place they have to turn is each other. So it's a mess, but we have to have these conversations to sort through it, you know?
Terrible indictment, isn't it? Uh, but yes, on that point, I have had spoken to patients with this, and I'm sure you have many times and probably experienced it, where even water on the skin is too
Mhm.
traumatic. The concept of putting an emollient on the skin is horrific,
Yeah.
not because you're anti it, but because the skin is just too sensitive.
Yes.
And so wearing clothes is almost unbearable. So,
Mhm.
and yet you're losing heat from the body and you're cold. So
Yeah.
it's not that you're anti it, it's just that your skin will not allow it to use that.
Exactly. Yes, I lived between my bath and my bed every 2 hours for 1.5 years, had to lay naked on towels because my skin was oozing so terribly. And then the burn would get so terrible that I would have to get up and get in the bath. And when I did, everything that had oozed out, encrusted, now was ripped open again. And so it was just raw and having to get in. It was terrible. So the pain and the discomfort and the suffering and then being told something is literally adding insult to injury. So the patient community is understandably
Up and up.
angry,
And
up
so
in
they should
arms, yes, but at the
be.
same time,
They
it's
are.
like that's not helpful to solve the problem because on a human level, it's antagonistic and it's threatening. And so it's hard to have the conversation of like, okay, how do we find a path forward? And I wanted to bring up one conversation I had just several weeks ago when I was in Australia for a meeting with the International Society for Atopic Dermatitis. There was a dermatologist who was sitting next to me at dinner and we were getting to know each other a little bit. She heard TSW and she just got very cutting and very condescending. Oh, I don't believe that that's a real thing. That's not a real thing. And I was trying to just stay calm and stay confident, not trying to be defensive, but saying, no, this was absolutely different than my eczema, the baseline eczema that I had experienced. These were different symptoms. And I started talking about the symptoms you don't see. And just like to your point that you mentioned, how it's affecting thermodysregulation or the burning or the nerve involvement, things that you can't see on the skin. After, I don't know, maybe 5 or 10 minutes of talking, she started to soften a little bit and said, well, I know that medicine is always evolving and, maybe we could have gotten it wrong. And I thought, well, this is how we
That's a
move.
big move.
Oh,
Yeah.
it was a big move, but it
Yeah.
really took like standing your ground but it also explaining, being respectful, but explaining how this is different so that we can see a different picture. And there was another statement that was made that week by another medical advisory board member of ITSAN, Sandy Pandar. He was saying, what the mind doesn't know, the eye cannot see, which I thought was so true in our case. If you
Yeah.
don't know it, then
You
you
don't.
you call it something else. You diagnose it as something else.
Yeah.
So I
Yeah.
think a lot of it is just having these conversations and continuing to work together. There's a big trend towards shared decision making, and
Yeah.
I think that's to our fate, like to our benefit, to have these conversations. But again, like patients need to be empowered, be confident, knowing this is real, this is happening to me. We just need to find the right doctor, which I think is challenging too, because in our system here in the US, a lot of times you're assigned a doctor. Many people don't know that they can shop around.
Yeah.
That's money involved in that, right? Every time you have an appointment with someone, then you have to pay for that. So I think there are barriers to finding a doctor. I will say that ITSAN does have an internal list of recommended doctors that people have
Uh,
given to us. So they may not even know much about TSW, but at least they're supportive of that journey and they're trying to help their patients. So that's a good sign that we're heading in the right direction, but definitely challenging.
yeah.
Yeah. Well, my last question to you was, if a person's doctor is not supportive of how they want to treat, how should they proceed with their medical care? So if they're not able to find a doctor, what would you suggest?
It's sad that so many people in that terrible predicament have to resort to turning to others through social media, but actually, to some extent, they are turning to a very expert group, people who've actually lived it and breathed it and know exactly what they're going through. So I certainly think the support groups that are available, there are some on Facebook and obviously ITSAN, they can be antagonistic, and that is totally understandable and reasonable under the circumstances, but not necessarily productive. But I think that's certainly an avenue. They'd still need medical care. And I'm ashamed, as I've said several times, that my medical profession seems to allow itself to forget that, and that they have a responsibility to provide care. And even though we don't have the answers, that has been our role for centuries. And thinking back to 100 years ago, doctors didn't have antibiotics, didn't have antivirals, didn't have these other things, but they cared and they mattered. And we're facing the same thing with this, but we've forgotten how to care. And I think that is terrible. So I think that you need to try and find some common ground with your healthcare professional, whether it's a doctor or a nurse or whoever, and say, look, please, can we just agree that we have different views on what might be going on, but actually I'm not prepared to give topical steroids a go because I'm lived with this and I know what they are doing to me. Can we look at everything else around that? And so there are other things. I know people are using berberine. I know they're using metformin. You can look at anti-inflammatory emollients and see whether you can find some way of getting those onto the skin. So you hydrate the skin. Maybe dealing with sepsis, certainly alerting people to the life-threatening complications that can occur, and make aware that some doctors may not be familiar with those and won't have seen much of it. But try and find some area where you can collaborate and work together, and not against each other, not challenge each other all the time. I'd love to see our two communities, rather than sort of pointing out each other's faults all the time, try and find some way in which we can come together and say, let's look at this together, and let's find some, partly for research for the doctors, which would be fascinating, and they'll give us answers how we manage it. But it's telling us there's something going on in the skin here that we don't understand, and we need to understand it. And it's not beyond the wit of man to find out what's happening here. We will get the answers, and I think that we will understand what the phenotype is that causes this, or what is going on at the biological level that we can then manipulate and change, that will then just switch this back off. I'm very optimistic that our understanding of medical science is so incredible that once we switch ourselves into engaging with this, we're going to have some fabulous answers, which will just knock it back again rapidly. But we're not there yet. And in the meantime, we've got to focus on the softer areas of medicine, where care and empathy and compassion and time and listening and respect are dominant. Those are the things that I think as a profession we must focus on.
That's so good. It's a great way to wrap up our talk today. And thank you so much, Dr. Moncrieff, for giving us your time and for really caring about this community and showing us what good doctor looks like, and for giving some guidance to our community too, who's dealing with a really difficult situation right now.
Awful. I can't bear to think of people going through it on their own.
Yeah. Well, thank you so much.
Lovely.